my name is Dr. Karen Sheridan. I'm a clinical psychologist and doctorate level behavior analyst, and I'm the owner of Access Autism Testing and Consultation. And I'm here today with another research recap. And the article today is from the Journal of Autism 2023, and the title of it is I Live in Extremes, the Qualitative Study of Autistic Adults and Their Experiences with Inertial Rest and Motion. And this article explores two concepts, autistic inertia and inertia motion. Autistic inertia is explained as being difficulty in initiating tasks. So a lot of times people with autism report that they feel stuck or frozen and they want to complete a task, but they just can't get over the hump of that first step. And this plagues a lot of my adult clients. The inertia motion means when people with autism have special interests or hyper-focus on those interests, they have a hard time stopping that activity. So sometimes this can affect them with sleep. They might be doing their, intensive preferred activities all through the night because they can't stop themselves because they're so hyper-focused. It might make them not, check their phone or their text or turn down social obligations so they can continue to hyper-focus on whatever their intensive interest is. So those are the two concepts. And the adults that they interviewed in this study, one in particular said that autistic inertia was actually the worst part of having autism in his experience. And they talk about how working from home can sometimes be challenging because no one's there to kind of help you initiate tasks. Whereas in a public office, a lot of times you have other people around that can help you, direct you to do tasks. Some people did report that external prompting does help them with their autistic inertia, particularly like their partner helping them, getting them started, a staff, even their dog sometimes can be a cue to help them initiate a task. I know with a lot of my clients that have difficulties with this, we talk about the use of Kanban boards. People with autism are often visual learners, and a Kanban board is a visual representation of your progress on a task. Also, like setting alarms, having checklists, to-do lists, things like that can be helpful for people with autism to be productive. Inertia seems to be tied to difficulty with transitions for people with autism. People with autism suffer from rigidity. They have a hard time with change and unpredictability, and sometimes these transition states are hard for them because of their symptoms of autism. People with autism have executive functioning challenges, and initiating tasks and task switching would be considered executive functioning skills, which is another explanation for why people with autism can experience things like autistic inertia. If you think you're having difficulty with autistic inertia and you think you might need to be assessed for autism, please give us a call at Access Autism Testing and Consultation at 225-285-3956 or email us at accessautismtesting@gmail.com. Thank you. Bye.